My name is Megan Halderman. I am addressing the City Council of Washington, D.C., where I live, on behalf of the North American Opioid Epidemic Campaign. This is a extremely important campaign. Right now in our society, we are facing a crisis of epidemic proportions regarding the opioid abuse and addiction and overdose problem in our country. Currently, every year, over 28,000 Americans are dying from opioid overdose. That's more than death from car accidents and firearms. In DC alone, the rate of deaths induced by opioid overdose is higher than the national average. The economic impact of this crisis is massive. So far, $50 billion has been spent in health and social services for opioid prescription abuse, as well as $20 billion in emergency and inpatient care. Currently, we are dealing with this problem in three ways. First, we are improving prescribing practices, attempting to make doctors more aware of the major issue of overprescribing opioids. Secondly, we are expanding the use of naloxone, which is a drug used for narcotic overdose in an emergency situation. And thirdly, we are expanding the use of medication-assisted treatment for those addicted to opioids. So all three of our solutions right now currently involve drugs and are costing us millions and millions of dollars. So the North American Opioid Epidemic Campaign is advocating for to bring awareness and educate public health officials and healthcare providers about the effective and safe methods of acupuncture for treatment of chronic pain and addiction. The chief of the Centers for Disease Control, Tom Frieden, is also in alignment with these beliefs. He supports the goals of the campaign and believes that the two main reasons this problem, this epidemic is occurring is because, one, the overprescribing of opioids by doctors, and this has been going on for too long, he explains. And secondly, the availability and the influx of synthetic drugs on the streets right now. That people that are addicted to these opioids, they're able to get their hands on these cheap synthetic products. So I'd like to ask the City Council for approval to begin this campaign in our city. I'm asking for $10,000 to launch this campaign, which will provide resources and the means for these advocates of this campaign to reach public officials, to create change in legalities and regulations in place that are currently set forth for drug addiction, specifically opioid addiction, and the treatment protocols that go along with that. The North American Opioid Epidemic Campaign is about acupuncture and bringing awareness to this amazing alternative treatment that could and should be the first line of treatment for those addicted to opioids. And before addiction, before prescribing even happens, when patients come in to a doctor's office for pain management, these advocates are pushing for acupuncture to be more widely known, for the research about its effectiveness to be spread, and for healthcare providers to have the option to say to clients, acupuncture, this is what we're going to do for your pain, your chronic and acute pain. So these funds will go towards providing the means for these advocates to reach these health officials for the materials and the informational packets which the campaign has created, as well as litigation costs, which I see will be needed to create real change about this real problem in our society, in DC, and in our country right now. Thank you.